This conference has been arranged and called for in view of the current COVID-19 pandemic in the state. As we are all aware, and from the statistics and the graph which has gone viral, wherein the Honorable Chief Minister had clearly pointed out that within a span of 25 days, that is from 23rd of March 2021, where we had 23 cases only, active cases. On the 17th of April 2021, we had 680 cases. Compared with the number of cases last year, 2020, on 13th of April 2020, we had one case, and till 5th of August 2020, we had 665 cases. The number of cases within this short span this year is equivalent to the number of cases which took 114 days to reach the 600 mark. And here, this year, within 25 days, we have reached the same number of cases, and this is increasing. Today, a report of active cases is 134. In view of this, we have called this press conference to highlight through the medium that you represent to the public that the situation is alarming. And we have to take all necessary precautions as we did last year to arrest the number of cases and to contain this particular pandemic. All the details of why it spiked, it is my deep personal pleasure to inform you and to welcome the special panel which we have here with us. We have got the Joint Director of Health Services, MCH and FW, who is in charge of IDSP and the main person around this management of this pandemic. We have got the Joint Director of Health Services, MCH and FW, Dr. P. Manners, IDSP's Dr. R. Dingdor, who's in charge of immunization, vaccination part. We've got the Director of Health Services Research here to provide inputs to us with regard to these testing facilities available in the state headquarters. We've got Dr. Andreas Dekhan, who is a medical specialist and the Joint Director of Health Services Civil Hospital, Shillong. Dr. P. Pakma, who is a test specialist, Civil Hospital, Shillong. We've got Dr. Rajiv Sarkar, who is the epidemiologist, Indian Institute of Public Health. We have got Dr. P. Pakma, chest specialist, Civil Hospital, Shillong. Dr. Mevan Khubor, medical specialist, Dr. H. Gordon Roberts Hospital, Shillong, Dr. Vijay Nongpio, pulmonologist, Negrims, Dr. B. C. M. Young, microbiologist, Ganesh Das Hospital, Dr. Robert R. Marak, who's a specialist in public health. We've got our joint directors from MI, Dr. F. Khasi, and Dr. Y. Fira. We've got the person in charge of the IEC with regard to this COVID pandemic, Dr. B.D. Cruz. And with this special panel which you have got with us, we will go ahead with this press conference. Parlok paro iba peti akan ke program, but paro ini ki bedan lang kami akan ke Khubor, naki lat pakai Khubor, iba day na iba tho, but na ki video begini, both print and electronic. Kani kajing khot kani ya kani ke press conference kalong naman ba ki baro hapo ke jylla ke jing khamtam ha Shillong kilong ibang bah ada muntah but baling o muntah naman ba tang hapo arkusan sini ikis kijungi kiba nilakot hadu ndrus patam kaya marga but kashispa khatsal sni mention snem hawa hajar afo kashimpor hadu shispa khatsal sni watlai nilashemi kilat kiba fer Banyada nang ikutang Jepang ujar senam, kasimpor ini kata nrei mental senam tengah po arfu sansu. Nikoi markat jo kaba kerekod kaba ujar senam kalau kasimpor hadu sispa kasal sini. Dan kata-kata nakaliang jong ke department ke jong ini Jignkiew ini nakaliang government, but Pynsngewthuh syai. Balai bukan orang ni. Ngidon makni ini doktor, kisah doktor, ki fer nak yang ki specialty tu ki fer badan bakni makin ai kajing pensyai ha kebai dei bat kini ke Khlam ke pemerintah Biang sampai di paro saya sisir bat nga kermen ban lembar jong kini ke press conference kemudian mentah kanuan rak yang ya kajing fikir kajing Jignkiew kajing Pynsngewthuh ba nginlong ibu penkre ya ke kabandangwan Bentar, Halor ini jikran ibarat ni pelat akhbar dofi. Now we leave it to you to please put your queries, and accordingly we will respond to each and every query which comes from all your good selves present here, so that the same information can be disseminated to the public. And we are doing live as of now, and we hope that with this press conference we will be more responsible. We have learned from what happened last year. This year we should be fully prepared, and to stop this pandemic, we cannot depend on anybody here. Once you been shut, tang hakikat ni, tang kasarka, The responsibility is you and me. But kata responsibility na kaliang kajoki, na kaliang kajongan, na kaliang kajongi barfai. Kani kapan ay ni Khubor banilay ni Khlam. Then the Khlam, without forgetting that we have placed our faith, we have put in our prayers. We don't get Jignkiew ke bahwan, but we do ay man kasing. Yang boleh try kena buat ay yang jaga together that God with His grace will protect us always. But we have to be responsible from our side first, and then that grace will come. The number of ventilators in the government health institutions, that is invasive, we have got 32. And with the support from the central government, Ministry of Health and Family Welfare, we add another 54. With the BiPAPs, we've got 75. That is only from the government side. We have ramped up our oxygen, oxygen need. And as of now, I will tell you that we have got about 609 oxygen support beds and 65 ICU beds. So this is, distribution is across the state. Concentration is more in Shillong and in Tura. And this is our position. As of now, we have our own oxygen plant at Bernihat, and we have got firms which are supplying oxygen to all the hospitals, and that plant is in Amigaon in Assam.
One of the things with COVID, the important thing is that it's related to, because it's an airborne disease, it's related to people and people coming in close contact with each other. Now what had happened last year was that we had lockdowns, we had very little movements, which helped in reducing the contact of people. But this year what has happened is we do not have the relative lockdown, and also with the decrease in the number of cases that we saw from January and in the months of January and February, people started becoming complacent. Now if I walk today to Police Bazaar or anywhere in one of the crowded places, we all know how many people wear masks. And we know that in a lot of places social distancing is not being followed to the extent that it should be followed. And I think these are some of the important reasons. We had constantly emphasized on the fact that we need to avoid crowded places, we need to avoid closed spaces and close contacts as much as possible. And from the beginning of the epidemic, we've always, the basic tenets have remained the same. We should wash our hands as frequently as possible. We should maintain social distancing and wear masks. So as long as we keep doing it, we would have less rise in the number of cases. But if we do not do it, then the number of cases will go up. Of course, the other thing probably could also have been that the fact that the vaccine has come in has brought in some sort of complacency among people, thinking that if we get vaccinated, then we are protected. But we need to complete our vaccination to 2 doses for the protection to kick in. 1 dose is not sufficient enough to give us large protection. And also from the time we take the vaccine, it takes a certain amount of time for the immune response to kick in. So that will also, we have to factor that in. So I guess to sum up, I think it is complacency, not wearing masks, not following the basic protocols which has caused.
We had taken all precautions. We were successful up to a certain extent, although we had a large number of cases last year between September till November, till December. Now, all this time, even when the cases were decreasing, we had given the advisory on the 3 Ws. Wear your mask, watch your distance, and wash your hands. Those 3 are the cardinal instructions which we have issued. Pangalawa hangni, ba baros kata baki hiar ki case nadu December terter Ngi ai hi ki ju ki jing patha. Lightly ki w. What clap? Bandeng gamas. What clap? Ban sanitize lania ban san ikti. What clap? Ban pet ban kanong dan kajing yatur hajan lani kajing lambrum. Haki cakar ki bubun beri. Kita kidi kita ba daw san balay ka kiyo. Mentah kani kadai ke Khlam, but kadang dai ke Khlam. This is a pandemic and it's still very much a pandemic. Nobody has ever declared that the pandemic is over. Khlam patku. Lada ni shin ni gini gilat ni ada. We go by these protective measures, preventive measures. I am definite that we can arrest and contain. Ndray nadu itu people January Feb nilada bong na kalian ketemu. Ba lada ngin buat perking. Kamut lada kawan lani wan manu ibadan yang ni kitang Jepang kakloy bagian ini. Nama Pinpet kumbala om Dr. Rajiv Mantan Bapun Kim Pediang Mencel Stem Hapur Kastang Gani Ka Khlam Ngibun Apreng Gajini Ngidon Apreng Gajing Bam Tip Bat Namar Ngidon Apreng Gajing Bam Tip Ki Bapun Ki Priu Kim Pediang Ki Ong Kampoi Sini Ndek Kapoi Bat Ngimdan Ki Dawai Banyada Ni kami nanti Banginyo ya ke vaksin, nginyo ya ketika. We waited for a long time for the vaccine. And this vaccine came. And when it came, we asked a lot of questions about the vaccine, which is not fair. This vaccine is going to protect and prevent. It will prevent either from you contracting the virus and affecting you personally, or even if the body can't fight it, the severity comes down, the virulence comes down. We have seen that there were many people who have questioned about the vaccine, have refused to come for vaccination. But here, I will say it bluntly, vaccinate before it's too late. Nanong ni, I inject bakaneda, yafi, but kawai ni di Pynsngewthuh, kamtam ki kamna kena samna kebaya chudum senen, uni uknyang Jepang manta umat yunur. Yafi kena ki samna kebaya chudum senen yafi kala banum kata, kala banum lele yafi. Ndrai kan mau ba Philippashi. But kinu ibadan ka Jepang. Hayeng jongki kong ka diabetes, tani kinu kibra karta ka jongki. Kapalalong palat, ya ka ndrip substem. Kamot na yo yun yung Jepang kakloy. Banta, bat ka kamjur. Sa jisil, ay ketika, once more, vaccinate. This is going to protect us. Whatever mistakes that we have done in the past, how many months, let us learn from that mistakes. And from here, henceforth, onwards, we come out strongly and we respect one another. The other person opposite you will wear a mask and you will wear a mask. You will maintain distance, I will maintain the distance. I will sanitize, you will sanitize. So those are the basic causes of why we are having a spike now. This is a spike. We have been prepared all along. We are still preparing, we are still learning. Now, our main thrust is this. With the preparation for treating the severe cases, if any, we stress more on the preventive aspect. Preventive aspect are the SOPs that we have issued, the instructions that we have issued. I will say once again, 3 Ws. Manong dia say here. Penyadar, kita ilai kali kita boleh bawa mengai fi mentan. But Bangimsngewthuh, ba nang ni shikman. Kini kibangi ai Jignkiew ringkat bat kajing ai tika dan ni vaccination. Vaccination is the most important part now. You vaccinate yourself, at least we are dead sure that even if you get the virus, the virulence comes down. And when that happens, if you take care from your side, what happens? You do not put a stress on our health workers. Remember, if our health workers across the state, right from the doctors down, we work as a team in the hospital, we work as a team in any institution as health workers. For us, there is no hierarchy. If any of these health workers become exhausted, the question is not how prepared are we in terms of infrastructure, in terms of equipment, it will be the how prepared are we in terms of manpower. If we have less doctors, no matter how many equipments you have, how much infrastructure you have in place, you will find what is happening in other parts of the country. They are crying for a doctor, they are crying for a nurse, they are crying for the health workers. But there are none because most of them are exhausted. So nadafi nakalem kacung fi fikit kian, pishim kian, pinum ai yang kata kacing jenjang. Ya kini kita try kepada health department, ya kita try kepada police department. Di gamut, ya no di bersihkan jur ngilak berai, ya kacang semua lagi. That is the most important thing. We have the Epidemic Act in place. We have the Disaster Management Act in place. Now you have seen from the instructions given by the government is going to take action on those people who do not mask up. And that is what is happening now. So people should not complain when the authorities or the district administration steps in and takes corrective measures on this. Meghalaya, ba ngidang happeneng ke Khlam, but namar kani ke Khlam, kadang kani ke Epidemic Act, kadang kani ke State or kani ke Disaster Management Act, kaba ngila pencari mentar, but Halor kani Nagalyang, Khubor, Kibri ya district, kinle ya kebaran kam, but Khubor bekile ya kebaran kam, Meghalaya, balai bekile ya kebaran kam. Namar kani kacingbam kit kiai kejongi, and but kani but Shankuna to go for the fight. This will be the first step. Next step, pilai mentar ngila khang school. Ngila penduna ya ke jing yalang kanungut kibreu ke jing jejar kelas dangwan biang. But lada kitang ya le gini ki jing jejar kin nangwan biang namar balik ngi hapan perkhat ya ke jing im jong kibreu hi ora koi.
But also it is important that we know it from our own experience, that if we penalize, if we find people, always find a way out. I think the important thing also from our side is to ourselves think about the importance of following the protocols and doing it from our own self. And once we understand the importance of it, I do not think we'll require this kind of penalties and other things that we are talking about. And we know probably the compliance levels will be much higher. What is important to emphasize is, and we have been discussing this, the fact that the highest risk for transmission is close contacts in terms of COVID. And close contacts for us are usually people we know. So if we violate the norms, the protocols, we are not only putting ourselves at risk, we are also putting our close contacts at risk. And as long as we understand it, I'm sure that we would all be more, what shall I say, we'll all be more sincere in our efforts in maintaining the protocols.
Haba kari ni yale persya ban ba day ban di secret show. Hakapor bangi da pidi secret in yo cancer jeng tor, yo cancer jeng pasintur, kila ban yo heart attack, kila ban yo stroke, kibas ngap guna. Season ya thu, Pynsngewthuh ya kibreu. Balada di secret mungkin kan kita yang ngabang di. Balada di secret manga hajan jongpi kan kita ya pi bondi. Kajing di secret apo hijaka ba kahyar sendam. Te ha kaju kanong rem ngidi Pynsngewthuh syang ki patba. Ba ngin sim no ai kajing kit clear naka government ka hab bangi bros katang community ko government manle. Ngidai pan kem ni kibriu ki badeng mas. Ngidai pan pen sitam ya ki dukan ki bang fol ki bang buat ki bang la betha ngoman. Nrai hato kamdai ke ka bang kalim kamdai ke jing sisa ban ong ba lada don no bomdeng mas hajan jonga ngala pan yo ki jing sitam. Lada bomdeng mas hajan jongpi pi la pan yo ki jing sitam jonga. Nanga. Omdai tang nga Shubu piyo na ngaru, tang pi pinyo, saki kon jang pi, pa jang pi, kme jang pi, ime jang pi, kulung jang pi, ipara jang pi, ba armet hayang ila pinyo ay jing sitam. Te nga nakalian jongi ki medical staff ni bayo yaka jing jar jong ki padba abo kiyo ini kobe. Ngida kerpat rip. Ya pi ki patba baro ba pin ya le ba pin sim ni kita ka kitli haladi tang man su kem ya ti breu ki deng mas atrai ladang imle hi kumta panong ka jingkala kan ma nginom lahi ban le ya
Habang ngideng ka mas kumni ngideng ka mas ngka ka phut ri umdai putu no pini habang ibu ka mas untuk yung niladeng ka mas ndek ngideng ka po ketemu kani ka break fashion kani kami ke jylla kenma ba habo flada bi dengi ke masa habo fidan ki cakap ba ngin sutu ya kata kong doktor ke jingkit kya ke jing fikir ke de nangi kalau kaju fidang mas pi buram menga ngadeng mas menga buram pi nya buram ibe kaju banyak kali Ki filanya kekali nang ni ngalanya ski ngalanya jai ba. Bahkan nung dan kanung kat Stet ugan na stai ko kalian bothurmur banyak thurmur ugan terai kali jonga kaju ang ni ngila sim khia ngila le khia ki gorfat ndai kita di banah ko kalian kim sim khia te perkhat bahai ni kanung dan kanu kamdan kanu kamaladi kamdai bandan kamaladi ni kamdai bandan banong kajingnya batai start ngai ha kanu kapor pafidon kam kinong tre jong ka department ki gloi banwan chisnong ban Pynsngewthuh Halor ni kam bat nang ni syafmat sim khia bat tu le khia ki baro doktor te tanong turu nilayo ban keli ngila tes tingilayo ban segregate lupa ki naman ngila tip lupa ba ha ka tu ko cukai kana dan kalau break bun banong positif Te hangi nakiwan ki haban antai kastit kacungi kemun ngila segregate upai ki te halor kata ngin sapet ba hangno bangin bu iki bat kumno ba ngin ai kacung thai ki
Laban ai
figas ngin patio do mentan ngin patip kanungut ki ba one room te gamut menta ba ila ada beris mo figas question kemun ngiru nakalian ka ISP kila chumkia kin sapet kini ki bawan kemun ngila kali na history kacuki nangno bakiwan halor kata ba ngin sale Halor kata ka ba fi keli ki ba fi ai ba fi kita kajimut ba kadon kajing ba me deng mas hapor ba kidon kini ki election rally te mangi pe ka mangi ai kajing patha ni hapor kidon ki election rally pini bandon ka distance te kalong nakaliang jogi minister ki jongi badan boram begini chief minister klabo ya ka distance Ndrai nakalian kajing public kim ndrai tau kai ko fi dak ong fi manta ngin to Pynsngewthuh government
Pasal saya kamu datang, uyang nang berkibar ba, pan show jadi public, boyo ka full support.
Mana tu kita bagi orang yang nak pelakar election kenang bau COVID tu kan?
Tangan kini kita ni kita. Halor wangi ni sedang open up ni play ni yo ni hat. Kadang lang pakai SOP. Yang pajak. Hak ni orang ni. Hak ni kecing bakla kecing barakhat. Ngam tang yang pajak. Yang barakhat yang kecing bakla kecing. Nomor bola her. Ini kikis barakhat. Kadang kecing insting kecing lasting. Bom dan ini. But ngets kam bangi dan bok. But kumu kajas ko kalau wils ketua election ini ngisam dan ini rem hadu kunta. Kam dan rem ko break. Jadi ngets kam bagajing yana yangi najong kaya lang nanti hak jong po. Ndai ke go fi ngamla ai ban penthai ni ai kata. Jadi ke bangi di ban le ban kam ni sai le ban kam na po kaya department.
COVID-19. How many positive, that worldwide, there's worldwide data, but exact statistics I can't give you at the back of my head. But yes, let me reiterate, the vaccine is not a cure. We don't have a cure. What the vaccine will do is, number one, reduce the severity if by the unfortunate circumstance that you happen to contract the virus, it will reduce the severity in you, but it will not cure you. It is not a cure. So even after being fully vaccinated, you still need to follow your precautions, because if you look at it from the other side, a person who has been vaccinated, if you were to contract the virus, may not show signs and symptoms, but there is still a chance that he may transmit the virus from one person from him to the next person, even though small studies have shown, from Italy, small studies have shown that the risk of transmission of those vaccinated is still much lower than those who have not been vaccinated, but it is not zero. A person who has been vaccinated can still transmit, even though the chances of transmission after vaccination is still low. That is why, to cover up that last part, we still advise that you have to wear your mask, maintain your social distance, and follow the third W is wash your hands.
It is true that the immunogenic response to the vaccine is less when you take large amounts of alcohol post-vaccination. That is true for COVID-19 vaccine. That is true for other vaccines as well. Now, when someone says, I don't want to take the vaccine, I don't want to vaccinate, it's like you're saying, I am willing to accept the 15 out of 100 chance of me dying if I get the vaccine, especially if I'm an alcoholic. Most of them will have chronic liver diseases. A lot of the alcoholics, they have tuberculosis and have had tuberculosis in the past, so their lung is already compromised. Once there's severe liver disease, the kidney also is compromised. A lot of them have diabetes, which is coexisting with the disease. So if someone says, I don't want to take the vaccine because I don't want to abstain from alcohol, it's the same as saying, I am willing to accept the 15% chance that I will die of COVID-19. For us to say that it's okay to not vaccinate, I think it's wrong. It's very wrong. So people have to encourage themselves, and the relatives have to encourage their family members who are dependent on alcohol. One way that one can probably go around that problem is maybe you can contact any health facility before you take the vaccine, so that we can give the medications that will prevent the withdrawal syndrome. Preferably that can be done. It should not be a problem. We can give medications so that they'll not develop withdrawal, they will not develop seizures for the 28 days, or at least for 2.5 months. And if they so wish to take alcohol as adults, I don't think we have the right to say don't take alcohol as well. But during the time of the vaccination, if they genuinely want to take the vaccine, please contact any healthcare facility. We will be very glad to help them out during that situation. Thank you.
Now this applies to all types of diseases. If you are sick, even if you have acute gastritis, if you have common flu, if you have any other disease, when we prescribe medicine, the first advice is refrain from taking alcohol. For people who come for vaccination, our advice is refrain from taking alcohol. We are adults. When we say refrain, it's up to you. It's not going to kill you. It's only that it's going to deactivate the vaccine. That's all. Here we have this gap because we give a chance to the body to react to the vaccine and develop antibodies. We give that chance to the body. Hospital, we have got the COVID unit. Now with the decision of the government to come up with a COVID hospital, we are seeing that the best place for a COVID hospital now is that TB hospital in Saudi, and we are working on that. So as fast as possible, we want to bring up that up, ram up the facilities there, and then we will have our own step-down hospital or a COVID hospital, as you call it, here in Shillong initially. Then we will start to expand in other districts also.
Vaccine, healthcare workers, frontline workers,
Has yes, definitely got a lot of negative attention. Now, with regards to the fear of blood clots which was there, now two things you should remember. One, majority of those who have been vaccinated were the elderly. Now, the elderly per se, they by themselves form a major chunk of having those risk factors to develop a blood clot anyway, irrespective of whether they've been vaccinated or not. Now, whether this vaccination has caused them to this thing, or whether it has occurred, or whether it's just coincidental that they've been vaccinated and they've developed a blood clot, that is definitely being investigated, being looked upon. Whether the association is causal, that means the vaccine caused the clot, or it's just casual. Because a major chunk of the population vaccinated is the elderly. They already have their own risk factors.
Have we ever got 0 cases till now? We have not got 0 cases till now. We're still having cases. Till we got a peak, a spike here, we have never reached 0. That is why I'm telling you that it's a spike. It may be second wave, third wave, fourth wave, all these things, but till we reach 0 cases, then only if it comes again, then we can say second wave, third wave.
With the second wave, you can call it a surge, you can call it whatever you want. The worst is yet to come.
That you will have to stand in line for burial. You will have to stand in line for cremation. You will have no space. Nobody will come forward to help. Picture this. Kenmawi kata, ndan pihaban yang dulan, bantap beriu, pihaban yang dulan bantang beriu, pihaban yang dulan bandruh po hospital, kenmawi kene. Sya mempunyai kita kiki, kumpulangi doktor beban mantan. Ki Jignkiew ki bangilai, the instructions we have already given, follow them strictly. Don't make a joke out of it, because you will be at the end or at the butt of the joke if you don't follow the instructions very closely.
The containment has been done in many of the villages of Dawki, around 7 villages. And then till now, we are not getting any cluster, where we are getting only in the first, from the 12th of April. So that's all.
Ngayon kiduna bahag bawan syapat namatang ni vaksin. Tiang akan pat ikipai baru kiduan syapat makumbang itu ba amdan dawai setia ban penkoi ini nak ngecing pangkawit. Kabal priang Stet hadu kata-kata. Bat kai kibangila ban ngedai tadi bat ngin pendunai ngecing sakriang jong ngecing pang bat kabakadu ngila ban eradicate ngecing pang. Kalau utang dapat iyo vaksin. Tiang akan pat kibriu baru bikin ayo vaksin dosis bat amdan side effects iro yang. Lese buat lagi beriu tiang bayoran side effects sudah allergy bat kumrikum tai. Nrai hadu menta kumba silap prapuai ajar ngot kibangila. Vaksinit tang kumba aspa sapunya ngot kibriu kibayo cingpang malumala. Kata kalau utang ke Jignkiew kli Jignkiew met ke Jignkiew na jaga injek bat kiwai pat kabulumala. Tang kini lisipun.